Hi everybody, this is Mark Adajar from XSculpt. I'm one of the XSculpt surgeons and testosterone replacement specialists here. And I made this video to talk about the relationship between gynecomastia and low testosterone. It's a common question I get from patients, and I've been getting actually a lot of questions through Reddit and online regarding the relationship between the two and how to explain it. So I figure that I make this video so that everyone can have access to the answers. Okay, so basically, what is the relationship between gynecomastia and low testosterone, or is there a relationship? And the question is, it depends. But in general, yes, gynecomastia is associated with low testosterone, and how so? So basically, gynecomastia, if I'm sure everybody's watching knows, is an overdevelopment of the breast gland tissue behind and around the nipples in men. The reason why this occurs is, there's a proliferation of breast gland tissue, and the question is why. And that's where the low testosterone comes in. Essentially, what happens is there is an imbalance of your testosterone to estrogen levels, or the testosterone to estrogen ratio is messed up, is imbalanced. Okay, so what happens is you have a lower testosterone and a predominance of estrogen, and so when that estrogen becomes higher, or when you have a higher level of estrogen, it can cause these breast glands to develop. Now, if your estrogen is on the higher side, but your testosterone is also normal or high, then you won't get gynecomastia because the testosterone offers a protective effect. However, if you have lower testosterone but that estrogen stays high, then that's when the gynecomastia develops. So basically, the conditions that cause, there are, as you probably know, a lot of conditions that can cause low testosterone: alcohol intake, chronic high stress levels, poor sleep. Those are reasons that why guys can get low testosterone. Also, possibly, in the bodybuilding or the fitness world, use of anabolic steroids will cause gynecomastia, because this is a little bit of a different case, because you can take some sort of anabolic steroid to greatly increase your testosterone for the muscular benefits. However, it causes your estrogen to go way up. So despite having a high testosterone level, your estrogen level is much higher than it should be. And if you're not taking any type of aromatase inhibitor or any type of estrogen peripheral blocker, then the high level of estrogen will cause gynecomastia despite having a high testosterone level. So for those people who don't do anabolic steroids, or who has never done anabolic steroids, or is not on testosterone replacement therapy, the reason why you get gynecomastia is this imbalance between the testosterone and the estrogen, or easier to remember, an estrogen predominance. Now, the question is, what do you do about it? So ideally, a lot of these cases of gynecomastia appears in puberty, and it's very common that when a person, or I should say a young man or an adolescent, has gynecomastia, and obviously it's very distressing, they'll see their primary care doctor or their family doctor, and their doctor will tell them, it's temporary, it's due to your high hormone levels during puberty, and it'll go away when your puberty is over. And a lot of times that they're correct. The problem is, if your testosterone estrogen levels, if your testosterone levels high and your estrogen levels get way high, and the problem goes on for a year or so or more, the gynecomastia can become permanent due to the formation of like fibrous tissue or scar tissue within the gland itself, making the gynecomastia permanent. So the times where gynecomastia is not permanent in puberty is when the gynecomastia appears later in the puberty, puberty time, and then the puberty ends. So that the gynecomastia regresses before it can become permanent. So the times where the gynecomastia goes away in puberty is when the gynecomastia appears later in the puberty, later during puberty. Now, if the gynecomastia appears early during puberty, then that's an issue because the gynecomastia usually is constant or will continue to grow throughout puberty. And then by the time puberty is over and a year or more has already passed, and at that time the gynecomastia can become permanent. Now, there are ways to treat gynecomastia during puberty with medication. However, many doctors, rightfully so, are hesitant in prescribing medications in adolescents to cause the gynecomastia to regress or go away. Because with medications like aromatase inhibitors or stuff like peripheral blockers like tamoxifen, you have to consider the possible side effects as well. And so that's why prescribing these medications in adolescence can be a little bit of a tricky situation. And so it's very hard to get treatment for your gynecomastia during puberty. So often when gynecomastia appears early in puberty, it's very commonly permanent. I hope that answers the reason how the relationship between gynecomastia and low testosterone levels in puberty. But that being said, if you do have gynecomastia, not only would I recommend, and if it's bothering you to a point where you want something done about it, such as surgery or possibly non-operative therapy, then you should have your testosterone levels checked. Actually, specifically, you need your total testosterone, your free testosterone, and your estradiol levels, and something we call the sex-binding hormone globulin levels checked to determine if you are in fact low testosterone. Because if you're low testosterone, you get your gynecomastia fixed. That's great, your gynecomastia is fixed. However, then you will have symptoms and problems of low testosterone ongoing if it's not picked up along the way. At XSculpt, we always run a full hormone panel for all our patients who have gynecomastia as a screening profile, and we offer treatment for our gynecomastia patients thereafter, and it's been great because not only does testosterone replacement therapy help with the gynecomastia surgery results over time, but our patients are a lot happier, healthier, because they've been missing the benefits of having optimal testosterone levels. Okay, so if you have any questions, please leave comments down below, and or feel free to submit a virtual online consult with me or with my partners, or come in and visit us. We'd be happy to see you for either gynecomastia treatment or testosterone replacement therapy, whatever it may be. And I hope you enjoyed this video, and if you have any suggestions for more videos, let me know. Thanks.